Hello to all of our signing members. This is Katie Capps, Executive Director and co-founder of the Get the Medications Right Institute. I'm here with you today with a membership update for March and April. I hope everyone is safe and well. Like you, we at the Institute are adjusting to the new normal while doing whatever we can to continue to be a resource to our members at this very difficult time. As each of us does our part to mitigate the spread of the coronavirus, the GTMR Institute staff is working remotely and suspending business travel to adhere to the CDC's guidance for social distancing during this critical time. This means that while our physical office space will be closed, we will remain open by working remotely, and most activities will continue as normal. We are committed to moving forward as planned, using phone and video technologies to hold meetings and educational sessions. We'll revisit our remote work and meeting plans at the end of March and keep you informed of any changes. Staff will be available during normal business hours, 9 a.m. to 5 p.m. Eastern Standard Time. We'll be checking our voicemail at 703-394-5398 twice daily, and we'll return messages within 24 hours. Work group and task force meetings will continue to be held every other week during the set standing dates over the Zoom platform. For those of you that are leading or participating in our work groups, I want to thank you in advance for making the work of the Institute a priority during this trying time. The importance and urgency of our work has never been clearer. We know that many within the Institute are working on the front lines of patient care, and many others are working around the clock to provide the technology, diagnostics, equipment, and other resources needed to rapidly diagnose and care for our families and neighbors. Our intention is to continue to be a resource and virtual gathering place for our members. We're exploring ways we can harness the power of our community during this crisis. So at this time, as any other time, we welcome your ideas. To all in the GTMRx community, please accept our gratitude for your tireless work, innovative solutions, and heroic efforts. So now, let me update you as we enter our second year of operations. Among the first orders of business for our second year of operations was to hold our annual election of officers, and I'm pleased to share that the board has elected Dr. Paul Grundy as interim president of the Institute. Paul assumes leadership from co-founder Terry McInnes, M.D. On behalf of the entire board, I want to thank outgoing president and former board member Dr. Terry McInnes. Her vision and passion helped launch the GTMRx Institute just 1 year ago, and it played a major role in raising awareness of the human and financial cost of non-optimized medication use. Only 1 year after we publicly put a stake in the ground on this issue, and with over 800 members, under her leadership, we have far surpassed our goals to gain a broad-based coalition of support and to champion a solution. Now, let me tell you a little bit about Paul. As you may know, Paul is known as the godfather of the patient-centered medical home movement. He has spent 4 decades focused on population health and the value of a healing relationship of trust established with primary care providers. Paul's experience and leadership in the patient-centered medical home and primary care movements are particularly timely given the importance of engaging physicians in the work of the Institute. Paul is joined in leadership by other board members, Paul Abramowitz, ASHP, Steve Goldberg, Quest Diagnostics, retired Brigadier General Allison Hickey, All In Solutions, Dr. Ira Klein, J&J, Dr. Ed Webb, ACCP, and yours truly, Katie Capps, the Institute's co-founder, executive director, and president of Health 2 Resources. Now, we're entering our second year with strong tailwinds to advance our vision to ensure that appropriate and personalized use of medication and gene therapies is recognized nationally as an important way to save lives and save money. This is in large part due to work and support and active engagement of our executive members, work of our work groups, care delivery, payment and policy, HIT and AI, and precision medicine, work of our over 70 volunteers, and a broad and diverse community of over 800 signing members, representing those who pay for care, those who deliver care, and those who receive care. In fact, we've already surpassed our 5-year membership target. We've made significant progress toward a blueprint for change, and at our national February 6 call to action meeting with the Bipartisan Policy Center, we extended an opportunity for those on Capitol Hill and those at the state level to engage with us and the broader healthcare community on the issues that we're tackling through our Blueprint for Change. Now, let me tell you a little bit about the Bipartisan Policy Center event. The event, called Get the Medications Right, Innovations in Team-Based Care, is available on our website. During that meeting, we issued an important call to action to put the issue of suboptimal medication use onto the national healthcare agenda. When prescription drugs make you sicker, when they're wrong, or when they're used incorrectly, bad things happen, costing both lives and money. As a matter of fact, an estimated 275,000 lives were lost due to non-optimized medication use, and $528 billion are wasted each year. Despite this significant problem, the delivery system's trial and error approach to managing medications that contribute to inappropriate use of medications hasn't yet made its way to the forefront of our collective consciousness in the healthcare community or to Capitol Hill. All of you know that the GTMRx Institute is committed to changing that. Our morning at the Bipartisan Policy Center was just the beginning of a policy discussion kicked off in Washington, and we are committed to continuing that discussion until real change happens. February the 6th may have been our call to action to raise awareness among policymakers, but it's not our last call to action for reducing total cost of care and optimizing medication use. I invite you to take a listen to the recording of the February 6th event at the Bipartisan Policy Center by visiting our website. I've only scratched the surface here, so I urge you to listen and learn more directly from those that were attending and speaking at the event. Geisinger Health System, Health Partners from Minnesota, the Veterans Administration, the Commonwealth Fund, and others participated as part of that event. As a walk away from the morning public event, the GTMRx Institute held an executive roundtable where over 50 national health policy influencers joined us for a candid discussion of how we should move forward to actionize our work. This work is well underway, and in the coming months, we will put forth the Blueprint for Change. This is an important byproduct from that day, offering a path forward to achieve our goal of optimized medication use. Now, in addition to the work over February and March, we have a lot of exciting things to tell you about coming up throughout the year. You can continue to expect valuable programming through several webinars, issue briefs, podcasts, blogs, and other channels. Among the topics that we have slated to cover are the value-based care framework. How does comprehensive medication management add value? How CMM is creating remarkable patient experiences. Leveraging MIPS and MACRA to optimize medication use in the physician practice. The ROI for providers offering CMM. Optimizing value by optimized medication use, employers leading the charge. So throughout the year, we will continue to tap into the collective knowledge, experience, and expertise of our board of directors member companies, our executive member companies, our distinguished fellows, our work group members, and our over 800 members. We're also tapping into the expertise of key opinion leaders and collaborative partners like the Bipartisan Policy Center. We'll be featuring voices of many such leaders on our podcast. If you haven't tuned into our podcast, Voices of Change, it's back, and we've launched Season 2. In Season 1, we featured voices representing our board members, our board member companies, centered around transforming medication use through team-based care. In Season 2, we'll talk to experts who'll give their take on the central issues and opportunities to get the medications right. In our first episode for the new season, we talked to Dr. Anand Parekh, Chief Medical Advisor at the Bipartisan Policy Center. Anand is the author of Prevention First, Policymaking for a Healthier America. Voices of Change is syndicated on the Healthcare Now radio network, and you can find this episode on the website listed on this slide or wherever you listen to your podcast. Now, I want to take a moment to say thank you for being among the innovators, change makers, and solutionists advancing our mission. As you know, the Institute brings together patients, caregivers, payers, providers, policymakers, and others bound by the urgent need to ensure that every patient receives the right medications at the right time and the right dose. Please encourage your friends, colleagues, and others to become a GTMRx member. There's no charge for membership, but you must sign on to our belief statements found on our website at www.gtmr.org. I also want to ask for your help. We're making a special call for physicians to join our work. In order to expand our reach, the Institute needs the insight and expertise of more physicians and physician specialists as we consider effective team-based care models. We also want to encourage consumer groups to take up our call to action. We at the Institute are leading a national initiative to make care better today because we believe that team-based, precise, patient-centered models to medication use, known as comprehensive medication management, will save lives and save money. But don't just take that from me. You can learn more about embedding clinical pharmacists within your practice through a new AMA Steps Forward module. You can also learn more by following GTMRx's issue brief, Success at Scale, Comprehensive Medication Management and Primary Care. That resource can be found in the resource section of our website. I also want to mention that we continue our work with large employer business groups. We are in the process of developing our employer toolkit. This work is well underway with the support of Institute's distinguished fellows, Dr. Jonathan Watanabe and Dr. Jan Hirsch. I want to share just a little bit about that process with you. This past January, 9 large business groups, including 8 leading employer healthcare coalitions from Chicago, Philadelphia, Pittsburgh, Las Vegas, Kansas, all over the country, convened with the Institute leadership to offer invaluable guidance on an employer toolkit for use in educating employers about the current waste attributed to non-optimized medication use. We discussed in a full-day session how they can act together to be a driving force in the change from a trial and error system of medication use to one that is team-based, precise, cost-efficient, and most importantly, patient-centered. Employers as major payers of medical and prescription drug services can have an enormous impact in making sure we and our loved ones receive the right medications in the right dose at the right time. We believe that the development of this toolkit will be a powerful tool for advancing and implementing CMM into real life. Stay tuned. You'll hear more about this work over the coming months. And finally, evidence keeps coming our way about the value of getting the medications right. I encourage you to look for a new article, Optimizing the Primary Care Clinical Pharmacy Specialist, Increasing Patient Access and Quality of Care within the Veterans Health Administration. This article was written by work group members from the Care Delivery and Practice Transformation Work Group, Shawn McFarland, Heather Ourth, Julie Groppi, and Anthony Morreale. It was published in the Journal of American College of Clinical Pharmacy. The article offers a great description of CMM in the real world. I encourage you to read it, and let us hear from you. And to learn more about the innovators at the VA and what they are doing, check out our webinar and accompanying issue brief from last year, CMM Practice in Real Life, Clinical Pharmacy Specialist on the VA Care Team. This offers an example into how comprehensive medication management can actually be implemented with real results. You'll find other resources such as these on the resource tab of our website at www.gtmr.org. So with that, I wanted to thank you for listening to this update. We know that many of you are in the eye of the storm as the public health crisis steals lives, resources, and time, making us all wonder how to cope in this new normal. As you take specific actions to keep your patients, customers, employees, members, loved ones, and yourself safe and healthy, please know that you have the support of the Institute and our strong community of members. As we navigate these uncertain times, it's critically important that we take care of ourselves as well as those we interact with frequently. Our deepest gratitude goes out to all of you who are on the front lines, demonstrating bravery and commitment in the face of these challenges. If you have any questions about the changes we've implemented or have other concerns or needs, please don't hesitate to let us know. Again, we'll stay in close touch as we have additional information to share. Until then, we send you peace, positivity, and healing thoughts. We don't have to shake hands to join hands. Until our next membership update, be well.